On this morning's data, we have 6,289 cases of coronavirus confirmed in Australia. 57 people have tragically lost their lives, and we need to remember every one of those people has families who are still grieving. We have 80 people in intensive care unit at the moment and 36 on ventilators. But we have had a continual reduction in the number of new cases each day. There's no place in the world I'd rather be than Australia at the moment. Having said that, as my colleagues have been saying for the last few days, we cannot become complacent. We still have some community transmission, small numbers of cases, which do mean that there are people in the community that are transmitting this virus, and that's why we have to keep our pressure on and make sure that we don't end up like countries in the world that you've all seen on the news, where this pandemic has developed uncontrolled community transmission. We are in a good place, as I said a few days ago, but we have to maintain that good place. I'd like to say a few thanks. I'd like to thank the Australian people for embracing and living within these new, very restrictive measures that we've had to put in place. And they have come to the fore, as all Australians do. They have shown that they can change the way they behave. And I think, as I've said on other occasions, we will start to see a whole different way we interact, even when this is over, in terms of hand hygiene and distancing. I also want to thank our frontline health workers who've been treating the cases of COVID-19, but particularly today I want to recognise unsung heroes, and they are our public health workforce. There are 7,000 or so people working in each of the public health units in the states and territories doing case detection, contact tracing, isolation, and making sure that our transmission is contained. The single biggest reason why we have not had a terrible outbreak of community transmission is that we in Australia have got on top of those cases, 2/3 of whom have still been our citizens returning back from overseas. And these public health workforce in each of the state and territory health departments who've done that. We've set up to do that, we've set up to test, we've set up to trace. And this public health workforce, our enhanced testing regime, the way we have approached this pandemic so far is the way we can negotiate our way through the next months living with this virus. By having a strong public health workforce, we have put ourselves in this position of strength where we can plan how we move on. But at the moment, the message is the same. We must maintain our strong position of very enhanced social distancing measures. We are bringing the infectivity of this virus, the transmission of this virus under control in this country. We'll be in a position of strength where we can plan with the National Cabinet what else we can do to live with this virus over the next 6 months. Thank you.
Thanks, Brendan. Questions?
Yep. First question, sorry. I guess because we are in a strong position, the question inevitably comes, when do we start easing restrictions? When would be the earliest you would push to the stage that the state could look at easing some of the social distancing measures that have been put in place?
So I think it's really important that we look at what's happened around the world where people have released restrictions and have had to reimpose them. We have to get ourselves very well prepared, and that's why I was talking about the public health response. Obviously, the National Cabinet wants advice from the Health Protection Principal Committee about what are the things that would need to be in place, what are the measures, the surveillance, the tracking that we would need to have to enable them to reach a decision on potentially removing some of those restrictions. But there is a huge risk in doing so, and we've certainly said that it's not the right time now. We want to spend the next weeks looking at the framework with the National Cabinet and helping them to make a decision. I think I've also said in this room previously, there is no right answer. No country has the right answer. We are in as strong a position as anyone to plan a very cautious way forward, but at the moment, the most important thing is we keep our control.
So on that note, assuming we get this under control in Australia, is it likely that international travel will go ahead in the next 12 months?
International travel is another huge issue for the National Cabinet to consider. At the moment, the biggest risk to Australia is still returning travellers. 2/3 of our cases in Australia are return travellers or tourists, mostly our own citizens coming back. In fact, it's likely that the new cases we will see over the next week will be return travellers. We've just had a charter flight come into Melbourne this morning from a cruise ship with lots of positive people. So whilst this pandemic is across many other countries, we're going to need, in large numbers, we're going to need some form of border measures. What they will look like will obviously be a decision of the National Cabinet and Government, but it's until we get a vaccine or this virus moves through the community and is not very strong in other countries, we will need border measures.
So, Professor, is it then reasonable to assume that there will need to be social distancing practice in Australia until a vaccine is found? Is this going to become the new normal?
It is quite some form of social distancing seems very likely. We have always said that measures of some sort will need to be in place for several months. What they will take and how stringent they are will depend on the epidemiology at the time. But it's not likely. We've always said you couldn't put huge measures in for 4 to 6 weeks and suddenly remove them and life will go on. That's an unrealistic position, so there will need to be some form of social distancing, but Australians are learning to behave differently. You've all seen it when you walk into shops. You've seen people obeying the rules. You've seen people hand hygiene. People have washed their hands more in the last month than some of them have done in a whole year. These are all great changes into the way our psyche is.
Homes are among the most at risk. Is it realistic to ask people not to visit their elderly relatives for 12 months?
I don't think it's realistic for someone in a nursing home to not have any visitors. The Australian Health Protection Principal Committee recommended that people should be allowed 2 visitors a day under very strict, limited circumstances. I don't think it's reasonable at all that someone would be denied visitors. Now, some nursing homes, obviously when we had more transmission, were quite worried and they have restricted all visitors. I'm sure that they'll be reviewing that.
One of Britain's leading scientists has forecast that we could have a vaccine by September. What's your understanding of where that process is at and where...
Sure. So the Israelis have made a similar statement in the media this morning too. Look, it's too early to tell. If there is any disease for which vaccine development will be accelerated, it's this one. So it is hard though, because coronavirus vaccines haven't been successfully made before with SARS and MERS, but there are so many people working on this now, so many brilliant scientists, including many in Australia, that we can hope, but we cannot be unrealistic, and none of these announcements that I've heard give me enough confidence to say that those dates will be met, but these are reputable universities and let all strengths to their arm.
The National Rugby League restarting.
That's a matter for... I know New South Wales Health has been dealing with the Rugby League. My personal view is I think it's probably premature to be planning things at the moment, but that's a matter for New South Wales.
Yes.
Schools, have any more decisions been made on the schools? Is it likely they'll be open?
Well, the federal government has expressed a desire that we want all schools open. Now, the different states and territories will put in place different arrangements depending on their unique circumstances. But the NT, for instance, have said their schools will be open and they're requiring students to attend school for the second term. In Victoria and New South Wales, they're encouraging parents to, if they can, to have their students study at home. But what the nationally consistent approach is that But when it comes to parents who have to work, when it comes to vulnerable children, schools have to be open and have to make sure that they provide a safe learning environment for those children.